Ann Zabrowski from Apollo Performance, and we are talking to Susan Haynes today about a topic that I don't think has ever even remotely been addressed. Definitely not in the Beyond the Steps space, but probably not even in the dance, kinesiology, anatomy space as often as it probably should be addressed. And we're going to talk about why in dance medicine and science, inclusivity and representation is so very important. I think that as a show, we have definitely talked a lot about how a lot of what we know and what we learn and what we do has been rooted in a place in history that may not have included a lot of marginalized societies and communities. And it's time that we bring this to the forefront. And we're going to talk about that today as it relates to dance medicine and science. If you are watching this episode, listening to this podcast, please share and let people know. It is such an important conversation that we absolutely must have. If you are an avid viewer, please let other people know that you can catch us here all the time, anytime, and find us at Apollo Performance and at TP Dance Creations on all of your social media platforms. Without further ado, I would like for Bree to introduce Susan.
Yeah, happy Friday, everybody. We have Susan Haynes back with us today. She is a dance kinesiologist bringing new ideas in the dance science space directly into technique classes to prevent injury and build dancer-specific strength. Susan works with the causes of dysfunctional movement in the motor control center with neurokinetic therapy. She created dance conditioning technique to bridge research in neuroscience and fascia into dance training. She's the director of dance at Western Washington University and has presented her research at conferences nationwide. She studied fascial movement, patterning, and taping, and holds certification in NKT, NCPT, Pilates, yoga, FMT mobility specialist, and IASTM. You can find more about her at danceconditioningtechnique.com. And of course, she is also always a part of our live content and our blogs with Apollo Performance as well. Susan, welcome back.
Oh, thank you, Bree. Thank you, Melissa. Thanks for having me. It's always such a great pleasure to join you folks. I love the mission here and love all of the great work you are doing for the dance field and for dancers. So it's an
You're
honor.
Always so supportive, and thank you for that. We were talking a little bit before we went live about the changes in just the overall in the dance industry since the dreaded pandemic, right? And we really said it's just now starting to really bounce back. What's been the biggest change you've seen in dance medicine and science in that community over the past couple of years since we've come out of the pandemic?
I think there has been a big change. I think the focus on self-care, the focus on rest. I think we have all learned that bodies are not machines, and that ties directly into what the topic of the day, that bodies are so much more than a machine or a series of car parts. And I think that dance science and physical therapy is working to develop self-care strategies, an overall focus on holistic wellness, which includes emotional wellness and how that can affect injuries to heal and injury prevention. So I think the pandemic did offer us a chance to take a step back and see the importance of rest, see the importance of taking time. So that is a really good thing.
Yeah, and I think it may be a lesson we wouldn't have learned as quickly if we hadn't had it, right? Because I think that was something that specifically was tied to the pandemic for so long, and we've kept that habit, which is great. It's a good kind of launching pad for the dance community to adopt some new ways of thinking, especially. So I love hearing that. And let's kick off the first segment, Melissa, because I know we have a lot to dive into.
Yes, absolutely. I was so excited when we were going back and forth about what is our topic going to be. And Susan put this out there and I was like, yes, this is where I would love to go, because we have not, as I said before, really been talking about this issue. And I've never really heard it talked about before. So what led you, Susan, because I know you've been doing some research in this area and even did some talks on it recently. What led you to start to think about connecting these social issues like racism and inclusivity into anatomy and kinesiology?
Right. Thanks, Melissa. This started when I took over directing the dance program at Western Washington University. we did a big curriculum overhaul, and we worked to decenter whiteness in the dance field, worked to decenter Eurocentric forms. And so we're changing dance history. We are changing how dance is viewed. And I think so much of that work was to decenter ballet and decenter that canon. And great work has been done, I think, all over the world to show there is more to dance than just ballet. But in that, we'll say, undoing, that very important undoing, kind of putting an anti-racist lens on our curriculum, people were saying, oh, well, the sciences don't have to worry about this because they are the sciences. They are absolutes. They are fact. And I kept thinking, well, wait a minute, all of this other stuff, we treat that as fact too. Like, what is the absolute definition of a fact that we know? And how many times will I do the air quotes today? We hope not too many. Right. But I think what we knew, or what we thought we knew, what we thought we had a really deep understanding of, came from a very limited perspective. And that part of decolonizing our curriculum, decolonizing our pedagogy, was about bringing in multiple voices, multiple perspectives. And when we really drilled down into anatomy and dance science, the very foundation of that work comes from a very limited perspective of that idea of the map of the body of muscles, the way we describe, oh, when I move this, this is what is happening. It is a very limited perspective. And who's to say what is true or not true, because we don't have enough information yet. But to acknowledge that the map of the body that we are working with, that we have used as a common language, comes from such a very narrow perspective of whiteness. The texts that we are using and treating as absolutes, like, it is not questioned. I think that is where we are limiting ourselves, and it is worth questioning the science. As controversial as that statement is, it is worth looking at how narrow a lens this is. So it started with that push to decolonize my pedagogy, decolonize our curriculum. And there had been a lot of work, I say a lot, there had been some work in the dance science field saying all of the studies are being done on ballet dancers. If you open up the textbooks that are used, and they are fabulous textbooks by brilliant, brilliant people. So I definitely want to honor the work that has been done by these folks who have led us into this very important field. We wouldn't be here if it wasn't for their brilliant work. But those textbooks, on the cover, there's a ballet dancer, usually a white ballet dancer. When you look through the pages, if there are human models, they are usually white dancers in a black leotard and pink tights. And so the dance science field was starting to say, well, what about hip hop? When you read through this text, everything is geared through the lens of ballet or Eurocentric, sort of Western concert forms. They're assuming that all dancers want is higher extension and more turnout. And so when you say, let's learn about the hip socket, a big part of that is, how do you get greater external rotation? How do you get greater extension? Because that's that limited viewpoint of all dance is, oh, I started to do it again. Did you see?
The air quotes. Yep. We're going to get a lot of those. A lot of air quotes today.
Yeah, I'll sit on my hands for a while. The idea of what dancers want from that limited perspective is improved ballet technique. And so there had been a lot of discussions in the field of, can someone do a study on hip socket use and the requisite strength for hip hop dancers or classical Indian dancers? Can someone do a study on the loads required for Kathak dancing? Like all of the huge variety of styles and genres, and yet the studies are being done on ballet dancers. And so just shifting that perspective in the field was helping to decenter dance science and make sure that multiple populations were being served, that we saw dance from a wider lens. But the research it's not out there yet. So when we're looking at hip strength, or this study showed this ankle strength is required for this kind of jump, it's mostly done on ballet dancers with more, we will say, balletic movement. So
I will say I agree with you. When we started Apollo, we're a company backed in science and research, and that's something that's been our mission ever since we started. But there was very limited research on the impact of dance on the body in general, and everything we found was related back to ballet. And so we really have started creating our own studies to reduce or to measure how this movement is impacting dancers and the lack of support and all those things. But those studies do take time, and it is a very, very long process to get one study done and published.
Right.
And it is really daunting. So I do applaud the patience and the dedication and the commitment you have to that, because it is not easy and it is not a simple process by any stretch.
Right. Yeah. And so looking at sort of the foundation of this, I was very much influenced by the work of Resmaa Menakem. I don't know if you know the book, My Grandmother's Hands.
No.
And it is a fantastic book. I believe he has a few more out. He's a somatic therapist and psychotherapist working in Minneapolis. And he talks about somatic abolitionism. And he is talking about the trauma that is stored in the body and how we can work to solve some of our racial issues by addressing the body. And he says that's what's missing. No one is talking about the body. No one is talking about how we can deal with that stored trauma. And
so that's a good segue into this next question, right? Is because there's going to be a lot of people out there that are listening to this and they say we're all the same on the inside. And generally that is true. But when you look at the body from a performance athletic perspective, should there be a more diverse school of thought from the dance medicine and science community and the dance community as a whole?
Right.
Because yes, we all kind of have the same parts and all of that, but it is, we are different. And is it important to recognize those differences?
Right. Absolutely. And my work with dancers and folks from all walks of life, I have never really seen a body that functions the way the anatomy textbooks say it should.
Wow.
And, and I think dancers know this. They'll say, my hip hurts here when I do this movement. You go to a specialist and they say, oh, well, no, it can't hurt there because that part of the body is not involved in that movement. It says right here on page 156 that only the deep rotators and the glute max externally rotate the leg. And then you're left, I think we may have all been in this moment where you're saying, well,
that's what hurts.
This is what hurts. I have some knowledge here, but my knowledge is being discounted. And we are part of a system where that scientific fact from the anatomy textbook, this is kind of a roundabout answer to that question of, are we all the same on the inside, or how do we even look at this? and honor diversity.
Mm-hmm.
That I think the knowledge that dancers have, the knowledge that all bodies have, can be very easily discounted from these science resources, from this reference point that is really just treating the body as a machine, that is just saying, it does this, it does this. No, what you're saying can't possibly be true.
Mm-hmm.
And it discounts our kind of lived experience in the body. And that's when I started thinking about, I am coming to this place as a white woman, a lot of privilege with the color of my skin in this country. How do I truly understand the lived experience in a body of color?
Yeah.
How can I work with a body of color when I do not have this experience? When I go into a medical office or I open up a textbook, I assume they're talking about me. I assume I have a lot of assumptions of my inclusion and my safety as a white woman. And
Mm-hmm.
and that privilege is not afforded to all bodies of color, unfortunately. And I think that's why this work is so important, is we are able to kind of open the doors to say, these assumptions don't work for everyone, and they are in fact oppressing a lot of people. So to be able to
Mm-hmm.
acknowledge, and kind of a literal and figurative example that I use is, I'm explaining how the bones of the foot transfer the weight, ground force reaction. And that is true. Everyone's foot accepts that ground force reaction. The bones share the weight.
Sure.
But the weight that I bear is very different than the weight that a body of color
Mm-hmm.
has to bear in this country. And so we're in sort of a different realm where acknowledging the stories, acknowledging that lived experience, it does affect the body. And when we use that term, I think it's important to bring in more than just the diagram of the muscles and the bones and all
Mm-hmm.
the tissues, because there is so much more to it.
Mm-hmm.
So
And would you say, until we get further along in this updated and more specific research, that we need to be listening to the patients a little bit more, and we need to be listening to their feedback and their what they're actually saying to us instead of discounting it?
I think absolutely. I think that's true for every relationship we have, right? Is how do we listen more? How do we, I think medical professionals or anyone who is, even dance teachers, we are all coming from a place of, we want to help. We want to use our knowledge and training to help and to heal and to do good in the world. But I think acknowledging that the lens that we might be using from this perspective of whiteness might not be serving everybody.
Mm-hmm.
Uh, there's a fabulous website. It was, I believe it's a physical therapist who was talking about why people need to squat differently.
Mm-hmm.
And he has images of bones, of femurs and the pelvis. And he's saying, look at this femoral head. It's very long, very thin. And look at the hip socket that goes with it. It's very forward facing, it's very shallow. And now let's look at this other set of bones. This femoral head is huge and thick with a really short neck.
Mm-hmm.
And the hip sockets are much more laterally facing and much more deep set. Can you imagine these people doing a squat or doing any sort of hip flexion? It is going to be like apples and oranges.
Mm-hmm.
Yeah.
So how can we possibly apply the same rules onto this body that like there are no rules. There is movement that is, we will say, looks correct, but I think dancers are masters at compensation.
Hmm.
And so what might look right on the surface after a couple years of that compensating,
Sure.
that's when it turns out, oh no, you've been cranking this out from the wrong place. You've been torquing in here and bracing. And so I think that's where, yes, listening and being open to the body is so much more than what the textbook says it is. And,
Yeah.
a lot of the research in neuroscience is getting into that. It's like we are more software driven than hardware driven. So, and
Wow.
I think, yeah, and I think dance teachers see this all the time. An example I use is the student who is just unable to bend their knee when they land a jump. Have you,
Yep.
right?
Yep.
And
Yep.
dance teachers say, bend your knee. And they go across the floor again and they say, oh, you, I meant really you. Bend your knee when you land. Remember, we talked about it. And then the teacher
Yeah.
says, we have to do a workshop on the importance of bending your knee when you land a jump. And the student is like, whoo, I get it.
Yeah.
Thank you for
Yeah.
absolutely. I'm in. I'm in. And then they go across the floor the next time and they're landing on that locked out knee and they don't know what's happening. And
Yeah.
the teacher just assumes that they don't understand when it's a much more complicated
Yeah.
system, whatever is wired in for that student. And it usually is that the upper fibers of the adductors that they're stabilizing and locked out up at the pelvis. And until they can soften and kind of shift that neurological patterning, they're never going to bend their knee. But it has nothing to do with the knee. So I think being open to the body is a lot more complex. So I think the answer is both. The body is more complex than we know, way more
Yeah.
complex than the textbooks make it out to be. But the answer is also much more simple. That yes, let's listen, let's look, let's see what might really be going on, even if it doesn't fit an existing model. And
Yeah.
and I think that's at the heart of any change is how do we shift? Maybe we don't know what we shift to, but if it doesn't fit an existing model, let's be open to that change. So.
To figure it out. Yeah. It's a great segue into our next segment. We said we might go down the rabbit hole on this, and we definitely could and are. And it's an extensive topic. For those out there just joining, my name is Bree Zabrowski, co-founder and CEO of Apollo, here with my fabulous friend and co-host, Melissa McDaniel Grisham. This is Beyond the Steps. Where every week we talk about issues that are impacting the performance athletic community, from racism, gender and equity, sex abuse and prevention, nutrition, psychology, and of course, dance, medicine, and science. Today, we are chatting with our friend Susan Haynes about why representation and inclusivity are important in the dance, medicine, and science community specifically. And, we just talked about, really needing to listen as a whole and shift the framework of the research and the studies that are being done to be more inclusive to all body types, right? But I think that there's a couple things I want to focus on here. Medical accountability. There is the world that we live in now. I mean, let's just be honest. Doctors are very afraid to say anything, the wrong thing, they're going to be sued. Malpractice is a big thing. Coming out of the pandemic, there's not a lot of trust for the medical profession. So it's really, really easy and ideal for medical professionals to pinpoint that research, even if it's wrong, because it's there, it's in black and white. Nobody's going to dispute it because there's nothing that can dispute it, right? And so at the same time, we're battling this insane amount of distrust from coming off of the pandemic and a whole lot of misinformation and conflicting information being tossed around the world. How do we get back to this place where medical and medical professionals and the general population can work together hand in hand, especially when we're talking about performance athletes that need a higher level of they need a more specific eye. They need a well-trained eye. How do we get back to that when there's this distrust that's just permeating our society?
Right, right. And I think that the problems with the medical field are vast. The solutions in the medical field, the miracles that they are performing every day, are also vast. I have
Sure.
a dance student who is in the hospital after a car accident right now, and they are working miracles. So I am on both sides of this today more than ever. But
Yeah.
I think absolutely dancers need to have specialists who understand the art form and understand the needs. We had a student recently who had a concussion, and the doctor said, well, you can, no strenuous activity, but your dance classes are fine. And the student comes to me with this note, and she says, well, what do I do? They told me that no strenuous activity, but my dance classes were fine.
Fine.
Return to dance.
Yeah.
And I thought, yeah, we know that that is not true. And, we're not going to make a big deal out of it. We're just going to run this through our own lens of rational thought, knowing what dance classes are. And no, you're not going to be dancing yet. And I think there is a lot of knowledge out there, a lot of very, very smart people applying sort of an athletic lens to dance training or a fitness lens. And yes, that can be helpful for so many dancers. But I feel like, and this is why I do the work that I do, to truly go back to the foundational movement and try to unpack what's really going on. I think Doctors for Dancers is a fabulous resource. I think that they are working to pair specialists who understand dancers. But even there was a post on Instagram that said, this is the exercise all dancers need to ensure
Yep.
requisite strength. And I thought, well, I want to know what is it? What is this most important exercise? And it was basically the airplane test, where you're standing on one leg, standing on a straight leg, the other leg is extended behind you, and you're folding at the hip to touch the floor with your hands. Only they had added 2 kettlebells. And they said, all dancers must be doing this to show that they have hip strength. All dancers must be doing.
Yeah, and that's dangerous because people are going to see that and go, I'm a dancer, I need to do that. But their body might be so limited that they can't do that. And then that's the whole mental game. And then it just seems so daunting.
Right. And I looked at that and I thought, yes, I am certain that a strength and conditioning coach, someone coming from that athletic training perspective, would say 100% this will solve all of their problems. They need to stand on one leg. They need ankle articulation. They need hip articulation. They need core support.
Yeah.
But every dancer I know would grab those kettlebells, check out the movement, and lock out their ankle, lock out their hip, and fake it.
Mm-hmm.
And not find true articulation through the joints, not find true support from the right muscles. But they would go into that training center and fake their way through it and think, oh, I'm doing something good for my training.
Mm-hmm.
And everyone would applaud them. And that's where it gets a little complicated. And I think that there is a lot to working with a specialist who dances or who was a dancer. I encounter this all the time. Students come and they have hip pain, they have knee pain. Um, some of them even have labrum tears at the hip socket, and then which causes a lot of hip pain. And they are kind of what I call sort of door stopping their turnout
Mm-hmm.
from the front of the hip socket.
Right.
And I am involved in a lot of listservs and Facebook discussion groups. And I say, well, all of those students all those dancers who their quads are just locked out, working to like keep them locked in that place of external rotation. And no lie, experts in the field, very famous people in the field will respond to me and they will say, oh, Susan, the quadriceps are just not involved in turning out the leg. Please review your anatomy.
Yeah.
Oh,
And
wow.
then it's sort of done because the expert said that is just not possible. The anatomy book told me it's not. And yet we all could look out, classes start at studios across the country in a few hours, and how many students would say, heck yeah, is there anything going on in my deep rotators and my glutes? Or am I just cranking this from the upper quad fibers? And so to be discounted as a dancer because there is this reference that is known as fact, that is known as an absolute, um, it's both good and bad.
Mm-hmm.
It gives us a language. It does empower so many dancers because, oh, now I know what's going on at my hip. Now I know what's going on at my ankle. But
Mm-hmm.
I think it also disempowers us because it really focuses on the body as a machine. It does not reference the neurological patterning. It does not reference what we have set up on our individual journeys. So it is both good and bad. I think that looking for a way to understand a deeper sense of the body or the physical structure, but instead we just keep going farther into that machine view. I think the 3D anatomy resources, the more you go into, like you can isolate muscles. Let's watch this muscle group do a certain action, and there's a 3D animation, but that's not a real body. It's an animation. And so my students say, I've got a big disconnect. I'm looking at this 3D animated body doing these actions, but that's not, is that really what my body looks like? And we
Right.
would say yes
Right.
and no. We are not a 3D animation. We are
A
a real
real
body.
body.
We're
Yes.
humans as well as this. So I think acknowledging that bodies are so much more than just car parts, right? Order a new, your carburetor needs to be replaced.
Right. I think this leads into the next section really, really, really well, Susan. But I do want to say this for those of you who are just joining us. There's still a good amount of show left, but you have missed some amazing conversation. Please go back and watch this entire episode. You can find the full episode at Apollo Performance or at TP Dance Creations on YouTube and on Facebook. So please start it over from the very beginning and listen to all the amazing information that Susan has given us so far. And make sure that you like and share and subscribe so you can catch future episodes as well. But, talking about the body and, not looking at it from a machine view, we were talking about the distrust, just, as part of the Black community, there's been just so many places where Black and brown bodies have been used as a playing ground for experimentation, for medical advancement. Here go air quotes, medical advancements. And really, it was really experimentation. And I think now, when you were talking about looking at a 3D view and seeing how, that's not what my body looks like, I think we also have to factor in there's intersectionality between the spectrum of gender identities, how we're looking at bodies now. We can't just look at a body that we consider to be female because it's female presenting, and think that this is the way this works, because that may not be the gender identity of that person. So do you think that kinesiology, sports medicine, dance medicine, and science is working to catch up with this full spectrum of gender identities, and also applying ethical protocols to make sure that that type of experimentation and just kind of trial and error doesn't happen again that's happened in the past?
Right. And I think that I would say, I hope that absolutely there are so much more controls on research, that those tragedies will never happen again. But we will, that is partly why we're doing this work, is to ensure that those tragic incidents do not happen again, and that bodies of all colors are respected and treated with the respect that they deserve. But I think it is a long road to building that trust.
It's a lot of complexity, a lot of layers, a lot of things. And then the flip side of that is the people that are absorbing that research and that are taking that in, their own biases about gender identity and race and all of those things, and in terms of how they're receiving the information as well. So there's a lot to unpack, and I do agree with you. It does seem like a very, very long road ahead, but having the conversations are a great place to start. So
right,
that's encouraging.
And I do think all of the folks, if you are working one-on-one with human beings, in any capacity for caring for bodies, as personal trainer, chiropractor, PT, all of those things, Pilates instructor, yoga instructor, massage therapist, all of the things. What I find is that you are there to treat the person in front of you the best that you can, and that you do look to see them as the person who maybe that person does not fit into the box that your textbook tells you. And I think that there is an issue when you say, this is the female pelvis. The female pelvis does this. And there are people that say, well, wait a minute, we're back to, is that true? Is that a fact?
Yeah.
And a lot of PTs say that even through the 80s, I believe, the textbooks would say the sacroiliac joint does not move. And they would get to that point in the training, and people started looking around the room saying, hold on. What is that pain I have every time my pelvic torque goes a little crazy, and I have SI pain and I have movement there. And then talking about, oh, well, only women have this happen sometimes during pregnancy because of the hormones. There are assumptions that have been made in that gender binary, that, again, don't acknowledge that all bodies are different.
So how do you think, knowing how long this road is and how much work it is to do, and this, the studies that have to be re-examined and more inclusive of all the things that we've talked about today and some things that we haven't, how do you think performance athletes in the meantime and that are from historically marginalized groups of people can demand change and advocate for themselves now?
Right. And I think one benefit to the pandemic is we can access people like we are doing right now from different locations, that you are not necessarily limited to the resources in your region. I think definitely find a practitioner that you trust, you are building a relationship with, and I think listen to your intuition. If you are being told, no, that can't possibly be true, or your experience is being discounted, I think find someone else to work with.
Yeah.
They might
Mhm.
have all the credentials in the world, but if they are not able to hear you and honor your experience, and build that relationship, find someone else. And I think people are, of course, limited by insurance and financial resources,
Oh, there's all kinds of obstacles. Yeah,
right?
absolutely. Yeah.
But I think
So,
being able to say, I need someone who understands what I am going through, to finding someone online. Maybe there is someone through Doctors for Dancers online,
Mhm.
um, that you will resonate with, and they will be able to have a similar lived experience for that.
yeah, and that's why we always
Mhm.
encourage, the studio owners or anybody that's working with children really should be building out those relationships with the professionals in their community so that when there is an issue at the studio or whatever activity you're doing, you're able to, instead of diagnosing it and wearing that hat yourself as the director or the owner, you're sending them to people that you've already built that relationship with and pre-screened and saying, okay, here's somewhere you can turn. They get it. And we're building out that resource list. And that's something we've been talking about a lot. I want to get to homework because this is something special we do on the show every week. And I think it's so important for people to really start seeing change as people want tangible things that they can measure for change. So Melissa, let's go to homework.
So Susan's been with us before, but I'm going to remind her we like to give our guest one small thing that they can do between now and next week's show. So next Friday, 7 days to make progress in this area. How can our viewers work to move toward being more inclusive in the dance, medicine, and science space?
Right. And I love the homework portion. I think this is fabulous. I think homework in this area is to do study the existing resources, acknowledge that Gray's Anatomy, which is still listed as the foremost text, this was created in 1858. And
Oh, wow.
they, of course,
Anything done in 1858 that is still referenced now is probably a huge red
right.
flag
And of course, I think it's
from any topic.
the
Yeah. Any
41st, 42nd edition is out there, and they have updated it every year. But this map that was made was by these two surgeons, um, cutting into the body, and the map we have this is what they followed. This was the cut that they made. And so when we were dissecting in the years that followed in current day, we're looking to find that map. Oh, good, I found this map. So I would say do check out the resources that exist, but also look at the work of Thomas Myers with the fascial anatomy trains. And Thomas Myers is saying, we know the body through the lens of, and pardon this sounds very grisly, but he's like, we know this through the art of butchery. That's what
Mhm.
created the map we have of the muscle system. And if our first forays into the muscular system had been different, if the cadavers had been washed in a solvent, our map would be very different. Our understanding of the literal insides would be very different. So I think check out the work of Thomas Myers and the anatomy trains. Gil Headley is doing fantastic work, um, with dissection and fascial unpacking and nerves and muscles, and is pulling it all together with just a wonderful humanistic perspective. Um, so I think check out the existing resources, check out Thomas Myers, check out Gil Headley, and see what kinesthetic sensations you have,
Challenges. Mhm.
and
Right.
and say, oh, when I look at these 2D images of the muscles and the bones, what does this feel like to me? How can I honor
Mm-hmm.
my own experience? How can I honor a little bit more of what I am feeling with the body? You know, I think a great example is all of the moms who have, or dads who have carried a kid on their hip,
Yeah.
and everything has shifted to accommodate the child and the bodies that have shifted. It's like, well, is that scoliosis, or is that a result of just living?
Compensation. Yeah. Living
Yeah.
it.
And I
Right.
think honoring that there isn't necessarily something wrong if you don't match the pages of the book. So maybe this homework is more empowering. If you don't feel like you match the pages of the book, that's okay.
Right.
We don't
Exactly.
we don't know if anyone matches the pages in the book. So I think honoring your own lived experience and acknowledging that many of our somatic practices are actually coming from indigenous cultural practices that have not been given credit.
Right, exactly. So challenge, challenge, challenge. It sounds like this is a challenge to what you already know. Honoring and challenging all at the same time. They do not have to be mutually exclusive. We also have homework for you. We have this same homework every single week to take the steps initiative. Bree has popped that there on the screen for you. Take that. Those are free resources that are available at the Apollo website that give you free training into a number of different things: dance, medicine, and science, racism, gender equity, sex abuse and prevention, nutrition, psychology. All of them are right there for you, and they're totally, totally, totally free. Susan, can you tell us how people can find you on social media platforms?
Yes. Yeah. I'm at danceconditioningtechnique.com on the web, and at Dance Conditioning Technique on Instagram and TikTok. And yeah, looking to change the field of dance science and dance training by going to these, like, really looking at foundations for movement and foundational resources. So,
Awesome.
Thank you. Thank you so much, Susan. This has just been an incredible amount of information and a lot to think about for our dance medicine and science community. They're doing fantastic work, and we're so grateful for the work that they have done, and look forward to seeing how it evolves going forward. I think it is going to be a long road, but it is in good hands. So we are always thrilled to have you. Thank you for being here and for sharing all of the information with us. We know you're a busy lady. So everybody out there, thanks for watching. Melissa, it's always a pleasure to be back here with you on Fridays. We're going to be right back here next week. We're getting to the end of season 3 here. We're already planning for season 4, and we do hope that you will join us. That's going to be debuting in October of 2023. We're going to take a little break this summer to turn Beyond the Steps into a podcast on top of other crazy things we have going on in our life. And we appreciate your support and you being with us every step of the way. We'll be here next week. And until then, we hope you continue your journey beyond the steps. Everybody have a